as a doctor, I went into medicine to help people to preserve life, not to preserve life against all other considerations, but to preserve health and preserve comfort as well. And we do, discuss things with patients about whether they want to carry on treatments that will sustain their life or not, and people can withdraw from treatments that other people would want to carry on with, and that's absolutely fine, down to people's choice. And then they have a natural death from whichever illness they're suffering from, with all of the support that palliative care can offer. And I think that's all very legitimate, and there's a good spectrum of decision there. But I think where we cross the line is where we start to poison our patients, to kill them, which is what this bill will enable. And that it is an assisted suicide. It would be me taking part in the killing of my patients, or some of my colleagues taking part in the killing of my patients. And I also treat people who come in to hospital having attempted suicide, and I help them on the road to recovery as well, both in the acute setting and then later on. And it seems to fly in the face of what I do.
So what would you, just a final point, what would you do then if this did become law and you were the person, the medic, the clinician in charge of that decision, where the patient says, I would like to take that medication now, please, doctor? Or would you leave the profession?
No, I would have no part in those decisions. We'd have to see how it plays out in practice, in terms of if I would be forced to cooperate in some way. But it would be very difficult for very many of my colleagues. And one of the things that's very unfortunate is that the bill doesn't allow opt-outs for hospices. So hospices would be forced to be involved in this in some way. Individual doctors might be able to opt out, but the institutions themselves would be forced to take part in it, which I think would not just poison the patient directly, but poison the palliative care system which we provide, which is the best palliative care system in the world at present.